Thanks for staying with us here on The Real Story. Our coverage of federal funding cuts continues. This week, hundreds of millions of federal grant dollars to combat gun violence and opioid addiction were cut by the Trump administration. We don't have specific numbers yet, but the governor's office did confirm to me Connecticut programs have been impacted by these cuts. Joining me now to talk more about it, Earl Bloodworth, Executive Director of Connecticut Against Gun Violence. Earl, thank you so much for being here.
Thank you for having me. How are you?
I'm good. How are you doing?
A little busy.
Yeah. It's been a busy week. So tell me first off, how did you find out about these most recent cuts on, I believe it was Tuesday?
Yeah, there was our organization is connected to a lot of different networks throughout the country, actually, and there was a notification that went out that some organizations have received notices that their funding was being cut. They went to their portal to draw down to pay people and continue programming, and as such, and they weren't able to. So. Yeah.
And what was it like, seeing that? How did you feel when you found that out?
I mean, it's a very disheartening feeling, and it's in a repeat cycle, unfortunately, because one of the first executive orders that went out, or a memo, I'm sorry, that wasn't an executive order, but a memo went out originally a few months ago and froze a lot of funding for a lot of organizations that do a lot of work in the community that try to cover the gap that the state and federal government can't cover. Yeah,
and so as we get more into this, about 365 ongoing grants, which funded everything from mental health care for police officers, support programs for victims of domestic violence, to, as we mentioned, gun violence prevention programs. And as I said, the governor's office confirmed there have been Connecticut programs impacted. What are you hearing and seeing, and what's the work been like in the past few days to kind of figure out just how far spread this is?
Yeah, so that is the process that we're in right now.
Okay.
I know of one specific group that's doing a lot of work in the community and community violence intervention, specifically focusing on women, which is ROCA, that received a notice that they were not being funded any longer. And so we are kind of just waiting to see what this is going to look like. I know, I believe it was last week that Governor Lamont put out a notice or a website where folks can sign up to show that they have been impacted or may be impacted by certain cuts to the government funding. So it's kind of a wait and see, but we are preparing to coordinate as a unified front in the state of Connecticut and throughout the country because the work is important. Yeah.
So really no estimate yet on just how many dollars this could be?
No. Yeah. So I know we were talking a little bit before everything got started. The BISCA, or the Bipartisan Safest Community Act, which was primarily authored by Senator Christopher Murphy, but was bipartisan. So it's not a partisan issue. It's not a political issue. It's a safety and life issue. Yep. And there's roughly $50 million left in that. The federal government cycle starts in September, their budget cycle. And so you have some folks that are receiving that funding right now. Yep. That's roughly $50 million left. It was signed off in 2022, I believe. Okay. So I have about 2 more years to go. And so you have people currently receiving, or were currently receiving, funding from this bipartisan act bill, and they no longer will get any of that funding. And then you had people that were looking to apply for the remaining funding and looking forward to that, and now that's also been cut off because it's no longer in alignment with the federal administration. So.
Coming off of that, when we're talking about possible impacts of these cuts, these were grants and dollars that were already approved, many of which were in the pipeline. So these programs were expecting this funding. How does that impact these groups and their ability to provide these services?
It's not expecting. I mean, they were already drawing down. Yeah. So you go into the office and, I have this program that I need to pay for women and children, formerly incarcerated people, what have you, and you go to the portal and there's no access. So you can imagine, you have programming and people that were dependent on you, have payroll to meet, so it impacts a lot. I mean, one of the things that concerns me, is one, there's going to be, unfortunately, some tough conversations that people have to have with their employees. Yeah. And then on top of that, this funding, because it was intentional, and I believe you you have a lot of success when you're intentional about something. This funding was intentionally aimed at reducing violence in our communities. And in some cities, New York, Baltimore, Philadelphia, Connecticut as well, there have been reductions in violence anywhere from 30 to 60% across the country. You have hundreds of cities and multiple organizations that are going to be impacted. So we're going to lose that progress and that positive momentum. But more importantly, I think the highest stakes of it all is that we would lose. We can foresee losing lives.
And that's what you talked about before, that this is not a partisan issue. It's not
Correct.
a political issue. It's about saving lives.
Correct.
You talked about some of those numbers. Can you share with us anything more specifically about what we've seen in terms of success here in Connecticut? Because we know, these programs have been backed not only by the community, but by our state administration and by our federal delegation.
Correct.
You talked about Chris Murphy obviously being a huge advocate for federal gun control measures, but what have we seen in terms of the successes here in the state?
Well, in the state, we've seen some of those numbers anywhere from 20 to 30% in reduction from this past year, with a reduction in homicide by firearms.
Wow.
Unfortunately, one of the things that still needs to be focused on, we did see an increase in suicides by firearms. So, we're making progress, but it's still a lot of work across the board. You have community violence, you have domestic violence or intimate partner violence. You also have the possibility of mass shootings. You also, have, Connecticut has been at the forefront of a lot of these things as far as creating legislation to make us safer. We have our Earl the red flag laws.
Yes.
We were one of the first states to do that. But unfortunately, there's still a lot of people that are not aware of how to engage, whether that's law enforcement or people in the community, which could help save lives from people that might be in a danger to themselves or in a danger to the others. So there's a lot of work that remains to be done, and this funding is critical to meet those needs. I was actually just at one of our collaborators, which is Compass, and they do a lot of work with youth. They're possibly going to lose roughly $137,000.
Wow.
And roughly, they spend roughly about $12,000 to $15,000 per individual to help them, navigate what's going on in their community and reduce and be proactive in reducing instead of being reactive around gun violence. At the same token, I've been in this for a while, but a little bit on a different end in reentry. And when I started in reentry, it was roughly 10 years ago. It cost around $56,000 to $60,000 to incarcerate someone. In the state of Connecticut now, that's over $100,000 to incarcerate one person. So we're better off doing it on the front end. And investing in folks and investing in these organizations and getting more return on our investment than paying for it at the end. It's way more expensive dealing with the aftermath. Whether that's in healthcare and rehabilitation, mental health for people that have been infected, because there's a ripple effect every time somebody is harmed or loses their life to firearms in every community. Funding Compass now to spend that $12,000 to $15,000 per youth to keep them on that path. So like you said, you don't have to pay later. The Department of Justice and Attorney General Pam Bondi have said that this money was rescinded because it no longer relates or reflects department policies. Attorney General Bondi saying, quote, grants for programs that do not align with the administration's priorities were rescinded, but the Department of Justice will continue to ensure that services for victims are not impacted, and any recipient will have the ability to appeal and restore any grant if direct impact on victims can be thoroughly established. I do believe it was floating around that appeal process would be about 30 days for programs. What's your response to that from the administration? So I'm not sure exactly what the new goals that the current administration has. Hopefully there can be some common ground, and there is an appeals process, and you can believe that every organization will be availing themselves of it. We're going to be looking from the state of Connecticut to meet with Attorney Tong. There is also a network of legal assistance being put together throughout the state and throughout the country as well, to address just those issues and see where some common ground can be met so that these life-saving services can remain.
Yeah. And last month, I believe in March, Governor Lamont asked the state legislature to put $4 million in additional funding into the state budget for gun violence prevention programs. And we know the legislature is in budget talks right now. You mentioned the congressional budget cycle. Our cycle's a little bit off. Our legislative session ends in June. But, we're already hearing from lawmakers they might not have a finalized budget proposal by then, and they may have to go into special session into the summer. What's your sort of message for them, or what are talks looking like right now with state lawmakers about funding for violence prevention programs, and maybe what they can do in the meantime when we're seeing federal funding being stopped?
So that particular funding that you're talking about is the $3.9 million that the Connecticut Department of Public Health has been receiving. Originally, it started off as funding, ARPA funding, which we all know is long gone, and we were, as an organization, successful in collaborative efforts getting permanent funding and a line item budget in the general funds for that funding, which is 3.9 over each year of the biennium. And we've met with Lieutenant Governor Bicewicz. We had a press conference with her about the importance of this funding. The governor then, when he proposed his budget, did have it in his budget. So we're hopeful that it will remain in the budget. A lot of the lawmakers understand, the legislatures understand the importance of this funding and have seen some of the results. We did have an additional press conference with Governor Lamont regarding this funding with some of the recipients of this grant funding, Compass being one of them, the city of Hartford and their Office of Violence Prevention. People know the importance of this work and have seen the results. Just last summer was one of the least violent summers that the state of Connecticut has ever had. And we would like to keep that progress going. But there are a lot of headwinds against this because everybody's looking at their budget, and every other day we don't know exactly what's going to happen or what's going to be like I want to say it was roughly $9 billion that was cut from the CDC, which impacted our Department of Public Health by the tune of $155 million. So we're really going to have to look at and see where we want to invest and what we consider an investment versus what we consider an expense. And in my estimation, as I said earlier, you're better off investing this up front as opposed to paying more on the back end and having it be more expensive.
Really quickly in our last minute here, as we watch this play out and as we anticipate these legal battles on the funding pause, what do you want people to know about how these groups are continuing to manage? You said there's going to be tough conversations, but we know at the end of the day, their goal is to always continue providing these services and programs if they can. So what do you want people to know in the meantime?
I mean, everybody that does this work, they are very passionate about it. Everybody that's doing this work was doing it before it was highlighted, and they were doing it bare bones, unfortunately. But you can see the fact that if we have intentionality and we have proper funding and support services, that they're going to have a bigger impact. So I can say wholeheartedly that the folks that are doing this work are going to continue. Myself, Andrew Woods, Jacqueline Santiago and her group Encompass. There are a host of people from Hartford, Charlie Grady and Hang Time, Mark Donald and Chrysalis. There are a host of people all over the state that are doing this work and are very passionate about the people and the lives that we're saving. And we know we're having an impact, and we're going to continue to do the work. We're going to figure it out. But it's way more helpful when you have funding.
Absolutely. Well, Earl, thank you so much for checking in with us. We're going to continue to be following this.
Thank you.
That does it for us here now on The Real Story. But if you want to watch these segments again, you can head to fox61.com or download the Fox 61 News app and watch The Real Story every Sunday at 10 a.m. right here on Fox 61. Have a great morning.